Let me ask you something before we go any further. What if I told you that your body might have been warning you about high blood sugar for months, maybe even years, and that warning has been coming from somewhere you would never expect? Not your blood, not your stomach, your feet. Most people believe diabetes reveals itself through a lab result. Your doctor orders blood work, and that's how you find out. That's how it works, right? But based on my experience, I can tell you that even before any blood test, your body is already sending you very specific signals about the presence of diabetes. You just don't recognize them because nobody ever told you what to look for. I'm Dr. James Cole. Over the past several years, the vast majority of patients who have come through my door have been seniors, and what I've learned from them has completely changed the way I practice medicine. Let me tell you about one of them. His name was Robert. 67 years old, a retired engineer from Ohio, a non-smoker who walked his dog every morning. Robert was a very healthy man. He came in for a routine checkup with no complaints whatsoever, and only because his wife insisted on it. Before I ordered a single test, I asked him about his feet. He paused for a few seconds and mentioned a numbness he'd been feeling, something he had written off as a normal part of getting older. We ran his blood work. His fasting glucose came back at 214. Robert had been diabetic for over 2 years, and he had absolutely no idea. Here's why that matters for you. The American Diabetes Association estimates that more than 8 million Americans are walking around right now with undiagnosed diabetes. That's 1 in 5 people with the condition who don't know they have it. Silent, slow, and quietly damaging nerves, kidneys, eyes, and yes, feet. The good news is that a simple blood test, around $12 at any certified lab, covered by Medicare for most seniors, can tell you exactly where you stand. But first, you need to know what to look for. And today, I'm going to show you 9 signs that were already on Robert's feet and that may be on yours right now. The first one is so common that virtually every patient I've ever had has already experienced it and explained it away before I even finished asking the question. Tingling. That pins and needles feeling in the feet. The numb foot that falls asleep. Almost everyone tells me the same thing. Oh, I just had my legs crossed for too long. And sure, that happens to all of us sometimes. But here's the question I always ask. Is it happening regularly without a clear reason? Because if the answer is yes, that sensation is not about your posture, it's about your nerves. When blood sugar stays elevated over time, the excess glucose in your bloodstream begins attacking the protective outer layer of your nerve fibers, a condition doctors call peripheral neuropathy. You can think of your nerves like electrical cables running from your brain all the way to the tips of your feet. Each cable has a plastic coating around it, and that coating is what allows the signal to travel cleanly and strongly. High blood sugar acts like an acid, slowly eating through that protective layer. The cable keeps working for a while, but the signals start getting cloudy and distorted, and that distortion is exactly what you feel as tingling. According to the American Diabetes Association, peripheral neuropathy affects nearly 50% of people with diabetes. It is the single most common complication, and it almost always begins in the feet. Tens of millions of people are experiencing this right now and chalking it up to nothing. My recommendation for everyone over 60, a 20 to 30 minute walk every single day. Not a run, just a steady walk. Movement keeps blood flowing to those nerve endings. And start cutting added sugar out of your diet today, not next month, today. The second sign hits people hardest not during the day, but in the quiet of the night. A burning, searing heat in the soles of the feet, particularly when lying down and there's nothing around to distract from it. Most of my patients blame the summer heat, a long day on their feet, or simply getting older. But when someone describes their feet feeling like they're on fire at night, I pay very close attention. I want you to imagine a fire alarm with a broken sensor. The building is perfectly fine, nothing is wrong, everything is in order, but the alarm is screaming anyway because the sensor itself is damaged. That is exactly what diabetic neuropathy does to your nervous system. The nerves in your feet have sustained damage from elevated blood sugar, and now they're sending incorrect heat signals to your brain even though nothing hot is anywhere near your foot. Research published in the journal Diabetes Care found that burning foot pain is one of the earliest reported symptoms in patients later diagnosed with type 2 diabetes, often appearing 1 to 3 years before any formal diagnosis. 2 habits that genuinely help. Drink at least 8 glasses of water a day, because proper hydration supports your kidneys in flushing excess glucose, and add fiber to every meal. Vegetables, legumes, oats. Fiber slows the rate at which sugar enters your bloodstream, and that gives those stressed nerve fibers a fighting chance. Now I need you to focus here, because the third sign is where this stops being uncomfortable and starts becoming genuinely dangerous. This is the sign that sends more of my patients to the emergency room than any other, a wound that won't heal. A blister from a new shoe, a small cut, a crack in the skin. Most people assume these things close on their own within a few days, because normally they do, but not when blood sugar has been elevated for any length of time. I want you to imagine trying to water your garden with a hose that is badly kinked. The water is there, but it simply cannot reach where it needs to go. That is exactly what happens with circulation in diabetic feet. Everything your body needs to heal is present in your blood. It just cannot reach the wound. High blood sugar causes the blood vessels throughout your body, including the tiny ones that supply your feet, to narrow and stiffen progressively. Oxygen, white blood cells, and the nutrients your tissue needs to repair itself simply cannot get through fast enough. And an open wound that won't close is an infection waiting to happen. The Centers for Disease Control reports that diabetic foot ulcers are the leading cause of non-traumatic lower limb amputations in the United States, more than 100,000 cases per year. Nearly all of them were preceded by a small wound someone decided to wait on. Tonight after your shower, sit down with good lighting and look at both feet carefully. Check between every toe. Check your heels. If you see any cut, blister, or broken skin, clean it gently with soap and water, apply an antiseptic, and cover it. And if it hasn't clearly improved within 48 hours, call your doctor. Not next week, 48 hours. The fourth sign is hiding right in front of you, and most people walk past it every single day without connecting it to anything medical. Discoloration of the skin, particularly around the ankles. A darker tone, a deep reddish hue, sometimes even a faint bluish tint. Think of your blood as a delivery truck carrying oxygen and nutrients to every part of your body. Your feet are at the very end of the longest delivery route, the point furthest from your heart on that entire route. When damaged blood vessels narrow those roads, the deliveries stop arriving on time. The skin, starved of fresh oxygen, changes color. It is a distress signal you can see with your own eyes, if you know what you're looking for. A study in the Journal of the American Academy of Dermatology found that these skin changes are detectable on average 18 months before a formal diabetes diagnosis. The daily habit here is simple: 5 minutes of ankle circles, toe raises, and calf stretches every morning. Even that small amount of movement gets blood flowing into your feet. And if standing exercise is difficult, elevating your feet slightly while you sit can make a meaningful difference. The fifth sign surprises my patients the most because it looks completely harmless. Cracked heels. Dr. Cole, my heels crack every winter. It's just dry skin. I hear that constantly. But now think of your skin as a brick wall. When the autonomic nerves sustain damage, the mortar between the bricks begins to crumble, and cracks start forming. And those cracks are not just a cosmetic issue. They are open doors for bacteria and infection. And in a foot with compromised circulation, that infection can become serious very quickly. Diabetes affects the autonomic nerves, the ones that control automatic functions you never have to think about, including regulating moisture in the skin. When these nerves are damaged, the sweat glands in your feet gradually stop working properly, and your feet lose their natural moisture from the inside out. The American Podiatric Medical Association identifies chronic, hard-to-treat heel cracking as a significant indicator of autonomic neuropathy in seniors, a condition directly linked to long-term elevated blood sugar. Moisturize your feet every single night before bed. A good lotion or pure coconut oil works well. Apply it thoroughly to the sole and heel, but never apply moisturizer between your toes. That trapped moisture is exactly what fungal infections feed on. I want to pause here and ask you something directly. Have you noticed any of these 5 signs in yourself or in someone close to you? If the answer is yes, I'd like you to write that in the comments. Just the word yes. I read every single comment one by one, and if there is something I can help you with, I always do my best to respond. And if this video is helping you, please hit the like button right now. It takes 1 second, and it tells YouTube to put this in front of other seniors who need to see it. Alright, let's keep going. The 6th sign connects your feet to something most people would never think to link them to: your kidneys. Swollen feet and ankles. Persistent swelling, deep sock marks at the end of every day. Think of your kidneys as the water treatment plant for your entire bloodstream. Every single drop of your blood has to pass through them to be cleaned. When high blood sugar damages those filters, the system backs up. That leaves excess fluid with nowhere to go, so it flows downward, and gravity takes care of the rest. High blood sugar damages the kidneys over time, and the kidneys are what control your body's fluid balance. The National Kidney Foundation reports that diabetic kidney disease affects approximately 1 in 3 adults with diabetes, and lower extremity swelling is frequently the first visible sign that the kidneys are under stress. When you rest, elevate your feet above the level of your heart, even a few inches on a pillow, and reduce sodium in your diet. Salt causes your body to retain water, which makes swelling significantly worse. If the swelling is new, persistent, or getting worse, bring it to your doctor's attention at your next visit. The seventh sign is the one I see misdiagnosed most often, particularly in men. Sharp, persistent foot pain that patients have been managing with over-the-counter pain relievers for months before they ever mention it to me. Dr. Cole, I've been taking ibuprofen for the foot pain for a while. I figured it was arthritis, maybe an old injury. I've heard some version of that story more times than I can count. Now imagine an empty parking lot and a damaged car alarm going off randomly. Nobody is trying to get into that car. The alarm is just broken. A damaged nerve behaves in exactly the same way. It sends alarm signals to your brain when absolutely nothing is wrong. When nerves are damaged by chronic high blood sugar, they don't always go quiet. Sometimes they become hyperactive, firing random, intense signals the brain interprets as stabbing, electric pain, like a hot needle through the foot. The pain is completely real, but its source is nerve dysfunction, not injury, and ibuprofen will never touch that. A landmark study in the New England Journal of Medicine found that painful diabetic neuropathy affects approximately 25% of people with diabetes and is frequently mistaken for arthritis or age-related joint pain. Every morning, before you put any weight on your feet, spend 5 minutes doing gentle stretches in bed. Flex your feet, circle your ankles, pull your toes back gently, and every night before bed, give your feet a slow 3-minute massage, light circular strokes along the sole and up the ankle. The eighth sign tells me how far things have progressed, and almost every time the patient's first reaction is exactly the same. "Oh, I've always had cold feet, doctor, that's just me." And I say, "In December, absolutely. But are your feet cold in July? Are they cold under 3 blankets while the rest of your body feels warm?" Think of your circulatory system like a heating system running pipes to every room in your house. When those pipes narrow from blood vessel damage, the heat simply cannot reach the far end of the house. No matter how hard the furnace runs, that room stays cold. Feet that are cold regardless of the season, cold in summer, cold in bed, cold no matter what, are a strong indicator of significantly compromised circulation in the lower extremities. The American Heart Association identifies peripheral artery disease as affecting over 8 million Americans, with diabetes being the single largest risk factor, and cold feet are one of its earliest and most consistent symptoms. The best response is a 30-minute brisk walk every single day, arms swinging, purposeful pace. This forces circulation into the feet and lower legs and, over time, can begin to reverse some of the early narrowing. Start with 10 minutes if 30 feels like too much. Just start. And the ninth sign is the one almost nobody ever talks about: hair loss on the lower legs and the tops of the feet. Think of the hair follicles there like small plants in a garden where the irrigation pipe has been slowly narrowing. The plants don't die all at once, they just gradually stop growing, and that absence of growth is your body sending a visible message about the health of your blood vessels, a message that has been developing quietly for years. Hair follicles need a steady supply of blood and oxygen to function. When circulation is significantly impaired by long-standing elevated blood sugar, the follicles in your feet and lower legs gradually stop receiving what they need and simply stop producing hair. Research published in Diabetes, Obesity, and Metabolism found that hair loss on the lower extremities correlates significantly with peripheral vascular disease in diabetic patients, and it is a sign that physicians are specifically trained to look for. Right after this video, take a look at your lower legs and the tops of your feet. If the hair is significantly thinner than the rest of your leg or missing entirely, schedule a blood glucose test this week, not this month, this week. $12. Covered by Medicare for most of you. $12 can change the entire direction of your health. Today we talked through 9 signs, 9 chances to catch something before it catches you. And I want to be honest with you. One of the hardest parts of my job is sitting across from a patient who has had every single one of these signs for 2 years and is only now finding out why. Not because they didn't care, they did care. They paid attention to their health, they simply didn't have enough information. But from this point forward, you do. There is just one thing I'm asking you to do tonight. Just one thing. Before you go to sleep, sit down in a well-lit room and look at your feet for 30 seconds. That's all. Examine the skin. Check between the toes. Try to notice whether there's any numbness. And if you see or feel anything we talked about today, don't wait until tomorrow. Call your doctor right away. The earlier you catch this, the more manageable it becomes. In most cases, a change in diet, a walking plan, and a single conversation with your doctor is all it takes. You worked hard to get to the life you have. Your health, your independence, your freedom to do the things you love. Don't allow something as manageable as blood sugar to quietly take any of that from you simply because nobody told you exactly what to look for. Now you know. If this video created any awareness for you, share it with the people around you. Tag a family member, a friend. You may be giving them exactly the information they needed without even knowing it. And if you want more conversations like this one, I put out a new video every week on topics that matter for your health after 60. Things patients rarely hear outside of a doctor's office. Subscribe and bring someone you love along with you. I'm Dr. James Cole. Take good care of the feet that have carried you through your entire life. See you next week.